Welcome to our fat dissolving training course. This course is perfect for a beginner or perfect for someone who's been in the industry and would just like to gain some more knowledge on the procedure. To begin with, make sure you do a consultation on your client. You also need to ensure that you speak to them, not just get them to write it down. Make sure that you speak to your client and make sure that you understand whether they've got any health issues, any health conditions, to make sure that they're also a candidate for the treatment. I would definitely encourage, where you can, if possible, clients prior to booking, try and send some pictures or do a little video and send to you via DM, email, WhatsApp, however you want to communicate with your clients, just to see if they are an appropriate candidate for the treatment. Not everyone is an appropriate candidate, and I say that to mean this treatment is not a weight loss. It's not a weight loss treatment. It's not something where if you're trying to lose weight, this is not the treatment for you. This is a perfect treatment for someone who's trying to contour, trying to lose fat, stubborn pockets of fat, for someone who's trying to mold and shape their current physique. Yes, does it go hand in hand with maybe someone who's on a weight loss journey? By all means, they can. But it's good to have that discussion with your client beforehand, so that they just have a more informed decision before they book the treatment and come and have the treatment and sessions done with you. What we do here at Fab Lab, we tend to leave treatments up to the client because we don't want to be pushy. We're not pushy on sales. It's literally you let your client kind of decide their journey on how they want to do their treatments. So for instance, with fat dissolving, we always recommend a minimum of 2 sessions. And then after the client has had 2 sessions spaced 4 weeks apart, they can then decide for themselves whether it's something that they want to continue with or whether they're quite happy with the treatments that they've already received and they don't want to continue. So let the clients know that each person's body is going to receive the treatment in a different way, simply because our bodies metabolize things differently. How one person's body reacts to the treatment, it's not going to be the same how another person's bodies react to the treatment. And that's just another way of just dealing with people's expectations as well. Let them understand that it's not an overnight treatment. Let them understand that just because their friends saw results in 2 weeks, they're not going to particularly see results in 2 weeks. They might even see it in 1 week. Everyone's body honestly just takes very differently to the treatment. On average, the best thing to let people know is that their results can be seen on average, and it's very imperative to say on average about 4 weeks. There will be some clients that won't see results until after 4 weeks, simply because that's what their body's decided to do. So it is important to definitely tell the clients, give them this information so that they can also go away and understand this. There are many types of different fat dissolving brands, solutions, etc. I will definitely say that it is good to do your own research and find out which ones you like best, and find out which ones you like working with. I'm just going to throw out some names of the most popular ones. There's Acrylics, which is probably the one that most people have probably heard of. There's Deso Body, there's Deso Face, there's Fab Lab, there's Sincella. There's quite a few out there. So I would definitely say maybe start with the ones that you've maybe heard of, and then branch into other ones and, work with them, see how they work, and with your client base, and definitely experiment, but always do your research, do your reading to understand what the base of that product is, how it works, because each product is going to work differently. So understand that, is this 4 weeks? Is this 2 weeks that people need to wait? Do they need to do massaging with this product, etc., etc.? What body areas can be used with this product? It's very important to note that and to understand that. So the main things that you require is your product of choice. So for instance, acrylics. Let's just say you're doing one body area, a small area. We'll get one vial of the product of your choice. What we tend to do is, this is a step that you have to decide for yourself whether you want to continue doing this step or not. We add a numbing agent called lidocaine into our solution, we add about 20 units of lidocaine into the solution to numb the solution. It laces over the solution and takes away that stinging sensation. So if you've ever done acrylics or had fat dissolving done to you before, a lot of people will report, oh my days, it's so painful, it stings, etc., etc. This completely takes away that sting. So it is something where you need to decide for yourself whether it's something that you want to continue to use or not use. I would advise to definitely use it because it's a lot more comfortable for your clients, and you'll find that you'll probably get repeat clientele simply because they've gone to you and they did not have that stinging sensation, to be quite honest. So if you had to decide yes or no, I personally would advise you to get some lidocaine and add it into your solution to lace over it. And if you do decide not to use the lidocaine, which is absolutely fine, it's not imperative, it's not compulsory to use them. I'd advise only using it on small areas at a time and not multiple body areas, and not for long periods of time, because in all honesty, your client will be quite unbearable and quite uncomfortable for your client, and that's not really what you're trying to do. I'll quickly touch on body areas that you can do, but the manual does go into this as well. So with the body areas you're able to do, again, with whatever product you decide to go along with, make sure you read the manufacturer's guidelines as well. But generally speaking, with fat dissolving, you can mainly do fat dissolving on your arms, on your thighs, on the back of your thighs. So like they call it banana roll. So just underneath the cuff of your bottom, you can do the lower belly area, which is probably a very popular area for ladies, especially that fupa area. You can do your waist, aka your flanks. You can do your love handles. You can do your full abdomen. You can do the little pockets of fats that some people get in their armpits. And obviously you can do your double chin as well. There are other areas that I may not have mentioned that you can do, but always like have a read and double check. Look at the manual. Look at your the product that you're using's guideline, and obviously they'll be able to tell you whether or not a particular body area can be done or not. But most body areas can generally done. Where you've got a small pocket of fat, stubborn fat, most areas can be done on the body. When you're injecting into the double chin area, one thing you do need to be aware of, you need to be aware of the fact that there are nerves around the face, especially near the jawline, that you want to try and avoid. So when a client is coming in for under chin fat dissolving, make sure that they put their face in a position where you're able to, pinch, grab hold of the of the stubborn fatty area, so that you can particularly inject into where there is like a meaty fleshy area. You don't want to be injecting directly onto a hard surface on the face, or where there's a bony prominence. You want to try and avoid that, because it is most likely a case where there is a nerve in that area. Not that you would particularly do anything that is detrimental, but it could cause temporary paralysis, which is obviously we will try and avoid. This has never happened to any of us, but it's just be cautious of that area, and just make sure when you are injecting, you are grabbing hold and you're pinching. Make sure they're either standing where you can see, or make sure they're lying down so that you can see as well. It's all going to while making the client comfortable, but you also need to be able to be in a comfortable position to inject and to be able to see what you're doing. What do you need for the procedure? Your product of choice, be it acrylics, Fab Lab, Deso Body, etc., etc. You'll need some syringes with needles attached to them. We usually use insulin syringes. That's what we would advise. We'll show you in the videos what we use. You also need some, we usually use Clinell wipes, with any kind of alcohol wipe to cleanse the area of any dirt or bacteria, because we're going to be introducing a needle into their skin, so we want to make sure that the area is clean. You'll also need some gloves, a kidney dish, white pencils, and your consent form that you would have done prior to the procedure. And let's not forget some lidocaine if you are choosing to use lidocaine. So here's a clip of lidocaine being mixed into a fat dissolving solution, and just showing you how we've mixed it. We would use usually 20 units of lidocaine to mix into acrylics, and that usually numbs the solution, so when it goes into the client they don't feel the stinging sensation of the product. Now this next clip details and shows how we draw the grids onto our clients, and we tend to do 2 centimeters by 2 centimeter squares, and we would inject up to no more between 20 to 30 units into each square. When you inject into each square, the product spreads upwards, downwards, left and right. So it's enough to cover each and every area within each square. This next clip shows how you draw up the solution. So the basics of this is that you need to turn the solution upside down, so that you then put your syringe in with the needle and draw up that way. If you try and draw it up whilst your solution is sitting on a table, it's going to be very, very difficult for you to try and get any of the solution. So turn it upside down and you'll be able to easily draw up the solution. I would definitely recommend, prior to your client arriving, if you're able, to just draw up a few syringes, just so you're not sitting in front of them drawing up lots and lots of syringes. This is probably the most tedious part of this treatment, and probably the one that takes up the most time. So if you are able and you have enough syringes, make sure that you have drawn up in preparation before your client arrives, so you're not spending the whole treatment drawing up syringes. So for instance, as a rule of thumb, one body area, at least 1 to 2 bottles. Again, what we do here at Fab Lab, we kind of tailor our treatments to the individual. One person might be okay with 1 bottle for the lower belly, where another individual is going to need 2 bottles. So we look at the individual in front of us and make a decision. So it's generally 1 to 2 bottles per body area. You would literally go between that 1 or 2 depending on the client in front of you. One very important thing to note is no double dipping. Once you have used a syringe, unless you are using the whole of that vial for that client, do not put a syringe that you have injected into any client back into the bottle. If you know you're then going to go and use that vial or bottle for another client, say for instance you're only doing under chin fat dissolving for client A and they only need three or four syringes, know that you should not, by any circumstances, any reason, put the syringe back into the vial. You need to keep it clean, ensure you've drawn up just enough for that client, and then what you then do, if say for instance they do need more, get a brand new syringe and draw up some more solution. Because if you're going to use it for another client, under no circumstance should you be using the syringe you've used on someone else, putting it back into a bottle, and then using that same solution for another individual. After you've drawn up, try and ensure that there isn't any air bubbles. As you can see, as we are injecting, we are pinching the areas. The pinching just helps to kind of almost absorb the little pinprick from the injection from the needle. It helps with the pain. Some people obviously have a high pain threshold, some people have a lower pain threshold, and so the pinching kind of takes their mind away from the injection site. I would recommend practicing on your friends and your family first, just to get into the swing of it. If you're new to, especially if you're new to doing any kind of beauty treatment, if you're new to injections, if you're new to fat dissolving, I'll definitely say get your friends, get your family, and document them. One of our mantras that we say here is no content, no clients. It is so important to get before and after pictures. Before and after pictures are the basis of everything for you in terms of retaining clients, getting new clients, and just showing your portfolio of what you're able to do. Once you've watched the videos and read through the manual and feel like you have a good understanding of what fat dissolving is and how to perform the procedure, the next thing you need to do is practice on someone. What we would require before we can issue you your certificate is we would like for you to send us a video of you performing the treatment on a client and just following the steps that we've shown you. You don't have to show us every single step, but mainly what we would like to see is you drawing up the solution correctly and injecting into the client correctly, drawing the grid correctly and injected into the client correctly. The main thing we really want to see is you just performing the procedure. Once you've sent us that video, we will issue you your certificate. It's CPD accredited and you'll get that sent out to you via email.